Greetings to Dr. Fadzel. Today our group 9 will be presenting our topic effect of omega-3 polyunsaturated fatty acids on brain function. Now, we will be discussing the relationship between omega-3 intake and mental health in young adults. Mental health issues such as stress, anxiety, and depression are becoming more common in this age group, especially due to academic pressure, lifestyle changes, and social challenges. At the same time, many young adults have poor dietary habits, including low intake of omega-3 rich foods. Omega-3 fatty acids are essential for brain function and emotional regulation, so understanding their role may help support mental well-being through simple nutrition-based strategies. This topic matters because mental health problems can reduce quality of life, academic performance, and overall well-being among young adults. Since omega-3 intake is modifiable through diet, it offers a low-cost and preventive approach to mental health support. What matters most is understanding whether increasing omega-3 intake can improve mood, reduce stress, and support emotional resilience. This can help guide dietary recommendations and public health strategies for young adults. Omega-3 fatty acids are healthy fats that support brain structure and function. The main types are ALA from plant foods such as flax seeds and walnuts, and EPA and DHA from fatty fish. DHA helps maintain brain cell membranes and improve communication between neurons, while EPA helps reduce inflammation, which is linked to depression and anxiety. Many young adults consume too little omega-3 and too much omega-6, which may increase inflammation and affect mental health. Therefore, adequate omega-3 intake is important for emotional well-being.
Okay, now I'll talk about situation analysis. So, omega-3 polyunsaturated fatty acids are essential for brain development and cognitive function. So, example of omega-3 are EPA and DHA, which are crucial for brain health, eye development, also cardiovascular health. So, primary sources of omega-3 are fish and fish oil. So, low omega-3 intake is common globally. So, this problem with faith is globally problem. 76% of the world population is omega-3 deficient. So, global consumption of EPA and DHA is well below recommended level. So from the table we can see the data show oily fish consumption in the UK. So from the table we can see that majority of the UK population does not meet oily fish intake recommendation. Average omega-3 intake remain below the recommendation level. Next, at risk group of low omega-3 intake. So the first group is pregnant and breastfeeding women. They may have low omega-3 intake, and this can affect the fetal brain and the retina development. So low intake of omega-3 among this group may cause by the fear of the high mercury content in the fish. They may affect the fetal or the baby's health in the body. Next, children and adolescents. Some of them are dislike the fishy taste, smell, and the oily texture of the fishy taste, also the fish oil. Some of them also face difficulty to swallowing the capsule that contain omega-3, such as fish oil. Also, the parent also concerned that the fish may contain high contaminant, such as mercury, that may harm their health. Next group, elderly. Some omega-3 may have medicine interaction with some of the medicine that the elderly take, so they might avoid to take omega-3 to avoid the medicine interaction that have happened. Also, high dose of omega-3 may cause increase of the bleeding risk. Next group are low-income population. They might have limited access to affordable oily fish and supplements. And finally, vegetarian and vegan. The vegetarian and vegan are mainly rely on ALA from plant, where the ALA is inefficient for the conversion to EPA and DHA. So this may cause the low omega-3 intake among them. So I'll talk about the bioavailability issue. So EPA or DHA from fish have higher bioavailability, where can easily absorbed by human body. So plant omega-3, which is ALA, must convert to EPA and DHA before they absorb by our body. So ALA need to convert to EPA and DHA. So this process is always inefficient. So large ALA intake are needed to achieve the benefit that bring same as the EPA and the DHA. Dietary pattern and habit. So some of the dietary pattern and habit may cause low intake of omega-3. So first, low fish intake. Low fish intake may due to the cost, income, availability, and personal preference. Geographic difference. Coastal population have better access than inland area, where they can easily access to the fish or seafood, where they have high omega-3 intake because they always eat fish, seafood, oily fish like this. Next, high processed food consumption. People nowadays more like to take processed food because they are convenient, also fast. So the processed food always have low in omega-3. Next, Western food dietary pattern. Western food dietary always have high omega-3. No, always have high in omega-6 but low in omega-3. Finally, vegan and vegetarian. Just as I said just now, the bioavailability of LAA is different from the direct EPA and DHA. So they have limited EPA or DHA due to the reliance on LAA, where they avoid to take fish as their food source. Next, environmental and cultural challenge. So here, 85% of global population does not meet the omega-3 need. Environmental issues such as overfishing, climate change, and also population can reduce the availability of omega-3 rich fish. People are also afraid of mercury contamination in the fish, so they may avoid to take fish and oily fish, just as I said before. So this may cause the seafood consumption decrease among them. Also cultural and regional factor, taste preference, allergy, and tradition. Also, some of them have limited access to the fish, also the geographical region, and also low-income area have fewer seafood options. Finally, policy and public health gap. So there are lack of mandatory omega-3 fortification program and also limited public awareness campaign nowadays. So people may not aware of the importance of the omega-3. Also, inconsistent global dietary guideline, because people may confuse what is the true guideline of omega-3 because there is different guideline in different region and also place, and the recommendation is often below the optimal level. Poor supplement regulation and inaccurate labeling of EPA or DHA also one of the problems that cause low intake of omega-3. Some of the product have high oxidation agent, which can cause omega-3 become less effective. So this can cause the omega-3 cannot absorb by our body. Last, the supplement need to regulate as foods but not drugs, so we can easily access to the omega-3 supplement.
For practical dietary strategies, the first point is to prioritize a food-first approach, focusing on the three primary types of fatty acids, which is the ALA, EPA, and also DHA. As for the second point is to obtain high-potency EPA and DHA is by consuming oily fish. Health organizations generally recommend 140-gram portion per week, with at least one being oily. Focus on salmon, mackerel, anchovy, sardines, and herring by choosing fresh, frozen, or canned options. As for the third point is to use canola or soybean oil for light cooking and flaxseed or walnut oil for cold dressing. As for the fourth point is to use alga oil as a direct plant-based source of DHA and EPA. And the fifth point is to three of these eggs can provide a similar amount of omega-3 as a small serving of fish for those who do not enjoy fish or seeds. Behavioral effects of omega-3 fatty acids is to improve in memory and learning. Supplementations with 900 mg per day of DHA for 24 weeks was found to significantly enhance learning and memory performance in patients with age-related cognitive decline. As for the second point is to cognitive task performance and responses times. Supplementations with EPA-rich dose allow the brain to perform cognitive tasks with less difficulty. As for the third point, behavior effect on social and emotional interaction, lonelier individuals typically exhibit worse episodic memory over time. However, high-dose omega-3 supplementations was found to reduce or eliminate these loneliness-related memory impairments. As for the fourth point is psychological drivers of behavior. Consumptions of fish oil result in higher levels of oxyhemoglobin and total hemoglobin, indicating improved blood circulations during cognitive activities. As for the limitations of omega-3, for cognitive decline, while omega-3 is often marked as a memory booster, several large-scale studies have shown it may not prevent decline in all populations. For healthy middle-life adults who already have adequate nutrient intake, adding more omega-3 often yields no measurable change in cognitive performance. As for the interactions with other nutrients, like the vitamin B requirement, a major limitation discovered in recent years is that Omega-3 may not work effectively unless other nutrient levels are sufficient. As for the third point is the genetic limitations, the APOE4 gene. Individuals with the APOE4 gene, a major risk factor for Alzheimer's, may have a transport problem where DHA does not efficiently cross the blood-brain barrier. Next is the threshold effect. If blood levels of omega-3 are already within a healthy range, taking additional supplements is unlikely to provide extra brain power. The most dramatic benefits are almost exclusively seen in people who are deficient at the start. As for the implementation barriers, the first point is the biological and metabolic barriers. A major barrier for those relying on plant-based sources, ALA, is the body's limited ability to convert it into the brain essential DHA and EPA. As for the second point is the food engineering and stability barriers. Omega-3 are highly polyunsaturated, making them extremely unstable when exposed to light, heat, or oxygen. As for the third point is the consumer sensory barriers. Many consumers find whole oily fish difficult or intimidating to prepare, compared to more common proteins like chicken or beef. As for the fourth point, environmental and economic barriers. Overfishing and rising ocean temperature have led to a global shortage of high quality uncontaminated fish. And for the fifth point, the omega 6 imbalance. The modern industrial diet contains roughly 20 times more omega 6 than omega 3.
Hello, doctor. I am Chi, and I will introduce the health benefits of omega-3 fatty acids. The first is heart healthy. Omega-3 fatty acids reduce triglyceride levels and liver accumulation, including the risk of atherosclerosis and coronary heart disease. Their anti-inflammatory and anti-thrombotic effects help control the platelet count. It reduces blood thickness, stabilizes the blood pressure, and increases cardiovascular and neurovascular disease risk. The next is brain and neural healthy. DHA is essential for brain and renal structure. During pregnancy, it supports further brain and eye development in the elderly. Omega-3 may help maintain brain function, neural cell memories, and reduce oxidative stress. Though evidence for Alzheimer's prevention is unclear, EPA may assist with mild to moderate depression, but not a substitute for medication. Omega-3 is also benefit to inflammation. It can reduce the joint pain in arteries and reducing the need for painkillers. But the potential benefits for both cells and asthma require more study. Last is eye health. DHA protects retinal cells and may prevent macular degeneration. Omega-3 also increases tear production to elevate dry eye health. Next is the impact of omega-3. The medical community supports DHA supplements used for pregnant women according to guidelines, which obstetricians and nutritionists have developed. Because DHA is a key component for the development of the fetal brain and the retina, choosing to eat enough seafish, such as salmon, or taking pre-fish oil supplements is an investment for parents in their children's future intelligence. Doctor recommends deep-sea fish consumption or omega-3 supplements based on your physical examination results which show elevated triglyceride levels, because EPA and DHA have been extensively studied to reduce triglyceride, anti-inflammatory, and stabilize glucose. People who work in office will experience confusion today, so they take DHA supplements as a part of their daily routine together with students who need to study for exam and elderly individuals who want to prevent their mental abilities from declining. The substance functions as a brain cell lubricant which enables proper neural signal transmission.